In the ever-changing world of business, an organization's success depends on constantly meeting new challenges and adapting to the marketplace. I'm Greg Gumbel. From e-commerce to investing, business strategies to human resources, join me as we take a closer look inside the workings of the modern global economy. Welcome to The Economic Report. The effects of new technology are best seen in the world of medicine, where it continues to improve lives every day. Let's examine this next story.
According to the American Cancer Society, over 1.4 million Americans will be diagnosed with cancer this year.
This has become a significant epidemiologic problem in that approximately 200,000 cases are diagnosed each year. Therefore, a very high incidence of this disease.
With the latest developments in genetic testing, there's hope that ovarian, breast, and colorectal cancer can one day be eradicated ahead of time in patients whose families have a history of the disease. Professor of Medicine and Chairman of the Department of Preventive Medicine and Public Health at Creighton University in Omaha, Nebraska, Dr. Lynch is considered one of the fathers of cancer genetics. During the 1960s, he demonstrated inheritance patterns for a previously unrecognized form of colon cancer and for the hereditary breast ovarian cancer syndrome, which he helped link to the genes used to identify high-risk breast cancer patients, BRCA1 and BRCA2.
And it's important to realize that each family affected with the hereditary version of this disease poses a potentially preventable problem.
A member of the team that identified the function of BRCA1 and BRCA2 was Dr. Jeffrey Holt, a board-certified pathologist with over 25 years of research experience. His company, Tissue Genetics Incorporated in Aurora, Colorado, has discovered a unique way in which to detect and treat patients with hereditary ovarian, breast, and colorectal cancer.
Our diagnostic test will indicate which patients have cancer that can be inherited by other members of their family. And this information should help select treatments for them, and it will allow physicians to screen their family members and hopefully prevent their cancers much more quickly.
Hereditary breast and ovarian cancers affecting younger women are more likely to reoccur and to affect the other family members. Once the gene is identified, family members can then be monitored, screened, and given treatments to prevent the development of cancer.
Our goal is to develop diagnostic tests that can be used to determine which patients should get which types of therapy and which families have cancer in their family so that these patients can be treated appropriately.
The company is currently pursuing the development and launch of 3 diagnostic tests, which will be prescribed by an oncologist and performed in the hospital pathology lab.
The BRCA test will confirm whether the patient carries a BRCA gene mutation, indicating whether their breast or ovarian cancer is hereditary or sporadic. ver03 test indicates whether the patient has Lynch syndrome or carries the HNPCC gene mutation, indicating whether their colorectal cancer is hereditary or sporadic. The ver03 test will indicate whether the patient will be responsive to certain drug therapies that are currently under development to treat their breast or ovarian cancer.
The test will be run on the cancer biopsy tissue and will take less than 24 hours. Since insurance companies are currently paying for similar tests, these tests are expected to be covered as well.
If you have the hereditary mutation,
educating cancer patients, their families, and potential investors about its new diagnostic tests, Tissue Genetics is generating a lot of interest.
To invest in tissue genetics is an investment in the future. We are trying to tailor our diagnostic tests to the individual therapeutics that will go with each disease. The FDA has mandated the critical path, and our tests, BRCA, ver03, and PARP-certain, follow that so that we can link a diagnosis to a treatment to individualize medicine to each patient's needs.
To learn more about this story, please visit www.tissuegenetics.com.